You've probably experienced this before. You've been to the doctor because you're having some UTI symptoms. They do their normal tests, but they come back negative. And they say, oh, maybe it's not a UTI after all. But you know that there's something wrong with your body and you know that you're having an infection. So, in this episode, we're going to be talking about three signs that you may have a chronic UTI, which is also known as an embedded UTI. So in this situation, often the tests they don't actually pick up the infection because the bacteria is hiding in the bladder lining, so they can often avoid being detected by the tests, by antibiotics, and by your immune system. So maybe in this case you go back and forth to the doctor, you're trying to manage your symptoms as best as you can. You're probably taking multiple courses of antibiotics and they just don't really solve the problem. The symptoms come back or they never really go away. So, chronic UTIs very much still under recognized in a lot of countries. In the UK, where I live, it was recognized by the NHS, which is the National Health Service, in 2022 or 2023, I believe. So it's only been a couple of years that they even admitted that chronic UTI is a separate condition from acute UTI and even from recurrent UTI. And I'm going to explain the difference between these three in a moment. And I think one of the problems that doctors have, they are because they've been told or they've been taught how to um, diagnose an acute UTI. They have the tests. Usually, there's two tests that they use, which is the dipstick test or there's the urine culture test. But these are not designed to diagnose a chronic UTI, so they are often just they're not very up to date with the current situation where women are having more and more problems with chronic UTIs. So I'm making this episode really to hope in my hope that you can trust your body and you can believe in your own intuition that if you feel like you are having an actual infection, then don't let anyone tell you otherwise. Seek alternative opinions, try different therapies and methods to heal. And because you don't have to suffer forever, I don't believe anyone has to struggle with UTIs for years. And that's what I'm here to talk about because I healed my recurrent UTIs when conventional treatment failed, and I healed with homeopathy and natural remedies, and I haven't looked back since. Honestly, I now manage most of my health problems with natural remedies, so it's definitely worthwhile to learn how to use it. So let's just clarify the definition between chronic, recurrent, and acute UTI. So, what's the difference? Well, obviously, acute UTI, when it's very acute, it just comes on suddenly and usually clears with short term antibiotics. So, this is like the one off UTI you maybe had when you were younger or even may have it now. Usually, very uncomplicated. It comes and after a few days, it'll be gone. Then recurrent UTI is when you get repeated UTIs, but you often feel well in between. So you don't have the lingering symptoms in between the acute episodes of UTI. That's a recurrent UTI. And then chronic UTI is a case where the symptoms never fully go away. So you always have that kind of sense that there's a low grade infection in your body and you just have such frequent flare ups that you basically just have a UTI constantly. Sometimes it's worse, sometimes it's a little bit less worse, but you don't feel fully healed or fully well. So chronic UTI is just not another UTI, so to speak. It's actually very persistent and frankly quite misunderstood condition because the bacteria are hiding in the bladder lining. So it makes it very, very difficult to detect and treat with antibiotics in particular. So that's why a lot of women start searching natural solutions or alternative solutions for their UTI, because the antibiotics just don't work that well. So let's talk about the 3 signs that may tell you have a chronic UTI. And sign number 1 is that you have persistent symptoms despite negative urine tests. So what does this look like? So this is when you experience ongoing burning, urgency to pee, your bladder may feel sore, achy, there's pressure in the bladder, you might feel discomfort in the whole pelvic area, and you might just not feel well overall. But when you go to the doctor and they do the test, especially the urine culture test, it comes back negative. So what does this actually mean? So in chronic UTI or in embedded UTI, the bacteria is hiding in the bladder wall, and they often form biofilms, which is kind of like a substance that the bacteria is able to hide under. So this makes it undetectable in standard tests. The tests can't see the bacteria because they're not present in the urine. So the dipstick test and the urine culture test, they're just designed to detect acute infections. But they really aren't sensitive enough to pick up the chronic embedded bacteria in the bladder. So this is why a lot of women are told there's nothing wrong, when in fact your body actually might be fighting a hidden infection. So it's actually quite staggering that even up to 90% of chronic infections may be missed by using these standard urine tests. So there actually isn't a reliable test a doctor can use to diagnose you with a chronic UTI. And that's why on average it takes 12 years to be diagnosed with chronic UTI, which is insane. That is such a long time. And often in between you'll probably get other diagnoses, or you're told like there's nothing wrong, it's in your head, or it's another condition. So just keep that in mind, that you might have to push your doctor or get another opinion if you want the official diagnosis. And even better, start learning how to use natural remedies to help you with the symptoms. It'll be quicker than 12 years. I can guarantee you that. And sign number 2 is that antibiotics only offer temporary relief and then relapse follows. So this is the chronic UTI cycle. So what it looks like. So your symptoms will usually briefly get better. You feel some relief when you take in the antibiotics, but then often they come back shortly after you stop the antibiotics, even within just days or just a few weeks. So the antibiotics don't hold, they don't solve the problem, they don't fix the UTIs. It's just temporary relief. What does this mean? So this means that the infection wasn't fully eradicated. The antibiotics only work on actively dividing bacteria in the pee. So, but when you have a chronic UTI, the bacteria is hiding in the bladder wall. They become so-called dormant, and they're not actively dividing. So the antibiotics can't reach them. It's not possible for the antibiotics to kill the bacteria that's in a dormant state and are hiding in the tissue and in the cells. And sign number 3 would be constant low-level symptoms between flares. So what does this look like? So even outside of full-blown acute UTI flares, you experience the subtle but constant symptoms like pressure, discomfort, fatigue, burning, and it just never ever seems to go away. And what does this mean? So usually when you have a simple acute or even a recurrent UTI, it has a very clear beginning and a very clear ending when it's responding to treatment. But chronic embedded UTI, there's like a baseline of ongoing inflammation and discomfort, and you never really seem to go beyond that. And that's, like I said before, when the bacteria is hiding in the bladder lining, they do irritate the tissue, and your immune system is aware that there's an invader in the body, but it isn't able to like find the bacteria because they're very good at hiding. But as they are aware, there's an alert from your immune system to the invader, and this causes an inflammatory reaction. So this is why you might have pain, swelling, urgency to pee. So this is your body's attempt to get rid of the bacteria. So it's actually a very natural reaction. Obviously, it's uncomfortable for you, it's painful for you, but it's a sign that your body is trying to get rid of the infection. So what can you do in this situation when antibiotics don't work very well? You're having constant symptoms, your body's own immune system is struggling to clear the infection, and it's a tough place to be in, but absolutely there are a lot of things you can do. So one of the things I always recommend the women I work with is to keep track of your symptoms. And this will help you to spot different patterns and flares and triggers. And because we often forget where we've come from, and we often forget what our symptoms were like. So even rating them, like rating your pain on a scale of 1 to 5 or 1 to 10, like how bad is it today? I personally make notes on my period tracker. It's just easy to have them in one place, like any health issue I might be experiencing. So keeping that symptom diary is helpful. So when you're dealing with health practitioners or doctors, then you can show them what's been going on with you. Another thing you can try is to really seek out practitioners and doctors who are familiar with chronic UTI and bladder health. And also, I would also recommend um, looking into using natural medicine specialists, homeopaths, naturopaths, any other kind of alternative practitioner, because I think they will have other tools that can help you as well. And if you want to work with me, then my contact details are in the description box. So that naturally leads to the next point I want to make is to start exploring natural and holistic options. So this can be a lot of different things. So you can start with just your food and diet and add in different supplements and vitamins. You can add in herbal medicines. You can learn how to use homeopathic remedies, which are excellent for acute pain management, and any other kind of naturopathic techniques, even Chinese medicine. There's so many different ways you can support your body beyond using just antibiotics. And then trust yourself, like your body's giving you real signals, and trust that. And trust that you will find the solution you're looking for. It's out there, and you absolutely can heal. So, I'll leave you there for this episode. If you are struggling with chronic UTI and you want to learn how to use, in particular, homeopathic remedies, herbal medicine, and certain vitamins and minerals and supplements to heal and manage your pain naturally, then I'm going to link my natural UTI protocol. It's especially designed for women who get UTIs after intercourse and after intimacy. But there's lots of information there, and you can start applying it to you from today and learn how to use these remedies. Because I don't want to sit on this information. I want people to actually take it and use it and experiment and start healing. And it takes a bit of time, but you absolutely can get there. Anyone can heal. Okay, until next time, and in the meantime, take care of yourself.